It's the Viva Eve Podcast, currently unnamed, but we're working on it. So today we have Dr. Rami Sartawi. Hello, welcome.
Thank you for having me.
Welcome to the show.
Thank you.
Today's technically like your first day with us, but you've been a doctor for a long time. You look very young and fresh. You are an interventional radiologist.
Yes, ma'am.
And you are coming to us because we've recently launched leg vein treatment here at Viva Eve. I'd love if you could talk to our audience about, as we try to scale a more integrated women's healthcare destination and bring in services that women need or would benefit from, what's the connection with leg veins, vein issues, and this demographic?
Sounds good. So again, thank you for having me. It's very exciting to be launching this at Viva Eve. So as you alluded to, I work with my sister, Dr. Varicose, and we are helping launch a venous disease service line, if you will, at this practice. And so statistically speaking, 40 to 50% of women actually suffer from some sort of venous insufficiency.
Okay.
You take all comers in the United States, 80% of patients are actually at risk for some type of venous disease.
Okay.
Fortunately, it's of the mild category. And so just being a women's practice, 40 to 50% of your patients could be suffering from venous disease. Often it's mild, and a lot of the therapy is just exercise and weight loss and compression socks. But there is a large percentage of patients that would benefit from symptoms, but they've never really known they've had it. For example, a patient that comes in and says, "Hey, I've had restless leg syndrome for a few years."
Yes, I have that.
There you go.
It's terrible.
There you go. So, often people think they have restless leg syndrome and they go on, years and years and years without seeking care from a vein specialist. And turns out it never really was restless leg. It was actually venous reflux, which we'll talk a little bit more about, shortly.
Okay. So 40 to 50% of women have some sort of vein disease. Is that hereditary? Is it caused by certain things? Like, what's going on with us?
So great question. So depending on who you ask, it's up to 70% of this is genetic, for better or worse.
Oh, interesting. Okay.
But unique to women is that they get pregnant, and that is one of the major risk factors for having venous reflux. So, for those who have been fortunate enough to get pregnant and have a child, it can put a tremendous amount of pressure on your veins, as you can imagine. And so certainly one of the risk factors, but really genetics and lifestyle now. We all, especially post-COVID, are leading a more sedentary lifestyle, generally speaking. More sitting than ever, more working at home
and all that.
Exactly. And so, sitting or standing for more than 2 hours is very bad for your health. Well, it shouldn't be so dramatic. Very bad for your veins. And so, that's one of the things that we'd like to counsel the patients here and at large to help prevent progression of vein disease.
So I didn't notice any major vein issues of myself until I got pregnant. I was around like 34.
Sure.
And now that I saw that one, I am seeing more and more kind of pop up. And for me, it's like I do have a little bit of restlessness, but what are some of the kind of earlier signs if a woman is like, okay, I don't like the way this looks, or I don't like the way this feels? What can they look for? And what are those kind of like flags for them?
There is a hormonal component. I probably should backtrack a little bit. So, and there's also a little bit of a genetic component where some people just get spider veins, but that's not by and large what's most commonly present. So what you see, the spider veins, and by the way, medical terminology for us, spider veins is a vein that's less than 1 millimeter in size. A varicose vein is larger than 3 millimeters. So you may hear me use those terms interchangeably, but that's what I'm talking about. So, 60% of the US population has spider veins. It is a sign, or it can be a sign, of an underlying bigger issue. It's almost like something brewing under their surface, right? And so people use the word venous reflux or venous insufficiency. You'll hear people call it different things. It's a medical condition where the valves in your veins just isn't working. They don't work properly. And so if you think about your veins as highways, and we're talking lower extremity right now. This can happen in any vascular
just
event,
legs.
But we're just talking legs right now at Viva Eve to simplify things. So venous blood is supposed to go from your toes upwards towards your heart. Think of it like traffic along a highway, right? When the valves stop working, traffic backs up. And that causes a lot of pressure on your legs.
That's a really good metaphor. That helps a lot, actually.
Thank you for saying that. I'm not sure, but I'm a simple guy and I need simple explanations of things. But so then the other thing you're always fighting is gravity, right? So gravity, if we didn't have valves in our legs, gravity would pull all our veins or all our blood down to our legs. And so, you have forces that are fighting this, your muscle contraction, your calf muscle specifically, your heart, obviously, every time it beats. And so, people with venous reflux put a tremendous amount of pressure on the veins in their legs, and that can manifest in many different ways. So, like maybe at the end of the day, you've been standing or sitting and your legs feel really tired and achy, and you want to put your legs up because it makes them feel better whenever you can. We talked about spider veins and varicose veins, but venous deficiency can cause ulcers and hyperpigmentation, which is like a skin thickening and a skin discoloration. And so, there's a range of symptoms, but I would say the most common, I'm sorry, that's a very long-winded answer to your question, but, aching legs, tired legs. Some women, have a hard time walking anymore. Like they just feel like their legs are so sore all the time, restless leg, you can't sleep at night. And, arguably the one symptom that, anecdotally, I could tell you, we're, very good at treating is cramps at night. Some patients have tremendous cramps at night. Doesn't matter how much water they drink, doesn't matter, what they do, but really it's a sign of venous reflux. And it's just, you're not able to get rid of the toxins that build up in your legs throughout the day.
Interesting. Because I get those sometimes, like a Charlie, what do they call them, like a Charlie horse or something.
Yeah.
And I always think I'm like, oh, I need to take my vitamins or drink more water, but really maybe talking to a doctor is the right thing to do.
It very well may be just dehydration or whatever, but I think what could be happening is you have venous reflux. And it's very easy to diagnose and treat.
Okay.
Really, it's just an ultrasound, right?
And we're going to treat it here.
Absolutely.
And I think it's important to note, like, we think about procedures, surgeries. How would you classify treating veins? Like minimally invasive? You're awake during the treatment? What's the kind of patient experience when I walk into the room and you're going to actually treat my veins?
Sure. So, before we get to the treatment, obviously, there's a treatment plan that has to go into place, right? So a patient comes in, you do the ultrasound, you counsel them, you make sure they're wearing compression properly, they're, hydrating, they're exercising, they're losing weight, doing everything. The patient has to do their part, right?
Right.
And then let's say you qualify for the procedure, and then there are many, many options. So the first surgery I ever saw as a med student was a vein stripping. It was the most traumatic thing. I can't tell you.
Right.
Ironically, no one really does that.
We don't really do it anymore,
often,
right?
No. So I, used to require admissions to the hospital, and it was pretty brutal. So it's funny that I ended up in the vein space, full circle. But I think today the treatments are very minimally invasive. Like the vast majority, like 99% of the cases are done with the patient awake. A little bit of lidocaine. It takes 5 or 10 minutes. You can close a vein. It's super fast. It's all through needles and using wires. Very, very easy. Very well tolerated by patients.
Okay. And I can have a treatment, a little bit of recovery here in the office, do my compression stockings and go home?
Absolutely. It's walk in, walk out.
That's great.
It's really great. There are some occasions where you have to do something called saprophylectomy or ambulatory phylectomy. That's a little bit more involved, but it's still outpatient. It's still like 30 minutes. When someone has really giant varicose veins, you actually have to do a minor procedure to take them out, but it's still outpatient. It's just that you have to take it easy for a couple of days after.
Okay.
That's less than 5% of what we do.
Got it.
Most of what we do is through a needle, whether it's injecting a medicine or burning a vein or, injecting some kind other agent to close.
Right.
So
because you can use radio frequency.
Yeah, very good.
Laser.
Exactly. So those are what we call thermal ablation techniques. So that you heat the vein and you essentially cauterize it. There's the human super glue version where you actually glue a vein closed, and then there's a medicine you can inject that's inflammatory and that can close veins down. So that's called sclerotherapy.
So you'd say, all in all, what we're going to be doing here with you at Viva Eve moving forward for our patients is basically as minimally invasive, low impact, but highly technical and technically advanced and for the patient experience. It's all
Absolutely.
optimal.
There will be nothing that you can get from a venous standpoint done elsewhere that you can't do here.
Okay.